When people start to engage and move their muscles, joints, and ligaments, that has a profound impact on metabolic systems, immunological systems, neurological systems. So the key concept to understand as we get into physical movement is there's different messenger proteins that are released by the musculoskeletal system. For muscles, they're called myokines. The liver releases hepatokines during movement. The heart releases cardiokines. The brain releases neurokines. And then the gastrointestinal tract, also during movement, releases gut metabolites. These have been shown in clinical research to impact every major type of chronic disease, whether it's chronic pain, chronic depression, anxiety, sleep disorders, diabetes, metabolic syndrome, neurodegeneration, bone loss, circulation issues, autoimmunity, dermatitis, you name it. The three most important clinical variables we deal with that can dramatically aid in chronic disease is one, how much movement are they getting, how much sleep, and what's their diet. They have to be able to get into healthy sleep phases when their immune system can do the job and they can get into a regenerative recovery state so they can recover from the autoimmunity and just demyelinated them. You have to remember that bones are involved with mineral storage and especially calcium. This is a reservoir for containing minerals and things like manganese and vanadium, some of the essential minerals. They're actually stored into our skeletal system. When people tell you they have osteopenia and that their bone volume has decreased, their potential for health and recovery have dramatically been impacted by that. It's a really big deal. So when you look at things like the skeletal system and you're seeing things like osteoporosis and bone volume loss, it's just to remember there's a direct relation between the amount of bone volume and bone marrow volume they have. And once their bone marrow volume becomes compromised, they're really losing the potential to make healthy amounts of white blood cells, red blood cells, and platelets. And the skeletal system is now part of the endocrine system. That these osteocytes within bone cells actually have an effect on blood sugar management and brain function and release of testosterone in order to regulate its volume and density. When we get exposed to toxic chemicals, one of the things that happens is the toxic chemical gets stored in our bones and body fat to prevent them from storing in our brain and organs. This is a protective mechanism. And it's not exposure, it's that the fact of losing bone and it's being released into the system. And these chemicals are devastating. They're going to definitely deplete antioxidants, put someone into an inflammatory state. They're going to cause mitochondrial dysfunction. That promotes all types of chronic diseases and impact recovery and energy production. So if you look at the before and after, you can see that bone loss itself that occurs in menopause creates a significant toxic chemical load on individuals. Key concept is individuals who are always cold and require a jacket at all times may have reduced muscle mass, which is a serious red flag. If someone has decreased beige body fat because they always avoid cold temperatures, like one thing that turns on beige body fat, so you have better thermoregulation, is putting yourself in cold environments. But the main thing that really protects people from not being cold outside is muscle mass. All-cause mortality goes up when you have sarcopenia, when you have decreased muscle mass. It's a really big deal. You have to get as much muscle mass as you can in your 40s and 50s and then maintain it as you get older. As a matter of fact, movement and release of myokines from muscles will have a much far-reaching impact on changing the microbiome than taking a probiotic. Each decade, there's a dramatic change in their muscle mass, and they have age-associated muscle loss. And whether they're physically active or not, for the most part, the key aspect with joints is really to move stability, allow weight bearing. But if the joints aren't functioning well, we can't activate muscles, release myokines, and promote bone density and bone volume with movement. Research clearly shows once you reduce physical activity, you're going to have depression turn on. When the brain is not activated from movement, it gets into a depressive state. Neurochemical releases change in the brain with that movement. As a clinician, if you can ensure that your patient can move regularly or exercise, your potential to achieve clinical outcomes dramatically improves for virtually every medical condition. Or to say it differently, whether it's a walk, it doesn't matter. Whether it's they're just going to sit in a chair and do isometric contractions, whatever they can do is going to have a far-reaching effect on the recovery, much more than any supplement you'll ever prescribe to them. There's no antidepressant that can beat the results people get when they start to have some movement. People don't need to run to release them. They just need to move. Like, you don't have to have a six-pack. You don't have to be super fit. One of the most powerful things about these extrakines is their effect on the immune system. They have a very powerful effect on dampening inflammation and turning on types of immune cells that help with recovery. Physical inactivity promotes loss of microbiome diversity and dysbiosis, independent of diet. Physical activity is one of the most powerful stimulators of bacterial diversity. Everyone's so focused on things like glutamine and nutraceuticals to fix leaky gut. Movement itself has a profound impact on changing the bacterial species in the gut, reducing gut inflammation, actually healing the barrier of the gut. As people stop moving, not only is their neurochemistry changed, not only do they get dysbiosis, but they do get neuroinflammation. They do get gut inflammatory responses. They get promoted into this inflammatory cascade to lead to things like depression and anxiety. So there's got to be that balance. Now, as a clinician, you should always be able to look for clinical red flags that a person's overtraining. The biggest clue that a person's overtraining is that their performance goes down and their injuries go up. These people destroyed their body. They were so addicted to getting their dopamine fix. Their gut would be destroyed. Their immune system would be weak. They get chronic inflammation. They're barely functioning. The other thing physical activity does, which is so critical for chronic disease recovery, is that it stimulates mitochondrial biogenesis and mitophagy. So this is another key thing that takes place with exercise. Exercise causes mitochondrial biogenesis, makes the structure of mitochondria much more efficient, helps get rid of the debris, helps optimize the ATP enzymes, the complex enzymes. So it's so critical for people to move. There's no nutraceutical that will reduce inflammation as effectively as exercise. Moderate activity seems to be the best. And then as they start going into overtraining, the risk of infection goes way up. So we have this U-shaped phenomenon. You want to make sure your patients aren't into that overtraining syndrome. If someone has Alzheimer's, dementia, Parkinson's, childhood developmental disorder, traumatic brain injury, they have to have a fit musculoskeletal system and activated so they can generate some kind of repair and recovery. There's no drug in the world that does that. You want to turn on repair of your myelin? This is the only way we know. Why don't you do that? Neurons spur into growth and rewire with physical activity, which is really cool stuff. Depression and hopelessness. When this kicks in with a chronic disease patient, it is very hard to get them to comply with anything. Key concept. Physical activity is essential for brain health. Physical activity has been shown to help with sleep, improve various psychiatric disorders. Exercise in general is associated with better mood and improved quality of life. Athletes with musculoskeletal injuries had higher levels of depressive symptoms, which raises the likelihood of them experiencing depression in the future. Even after the injury, the fact that they were injured for a period of time and their metabolic system was not activated, they're more prone for having depression later in time as well. That has a profound anti-inflammatory effect, which is isometric contractions. Just sit in the chair, contract the muscles for 30 seconds a minute, then contract their quads, their glutes, 3 minutes a second, and then just go back to work. That can negate some of these chronic inflammatory mediators just for prolonged sedentary activity. Kids that end up with sedentary activity, playing a video game all day, get into chronic inflammation, this will promote their chronic disease, this will promote their chronic asthma. For some reason, just being like extremely underweight and having no muscle mass is looked at as healthy. That's not healthy. You have to have some degree of muscle mass. Sarcopenia is often overlooked in clinical practices. Despite its profound influence on patient outcomes, physician healthcare professionals don't know how to treat our sarcopenia, which we'll go over. And sarcopenia has dramatic negative effects on all health and significantly increases risk for all-cause mortality. They're going to get all these toxic elements like lead, mercury, and arsenic that they've stored in their system throughout their lifespan, all released into their bloodstream at an age when they're vulnerable and can't really address that. The conventional medical model for osteoporosis management is heavily weighted towards pharmacology support, does not address underlying risk factors for bone loss. So the current approach to arthritis is basically anti-inflammatories, cortisone, and then just deal with it with occupational therapy and eventually joint replacement. Again, key takeaway message from this whole section. As a clinician, if you can ensure that your patient can move regular exercise, your potential to achieve clinical outcomes dramatically improves for every medical condition.